Well, Danielle, I mean, fantastic job, right? In really kind of setting the foundation that even with kind of revitalizing a program, it's still you kind of have to still go back to the basics, right? Um, and just on that topic, do you think that kind of going the more manual route initially and kind of putting things on pause and then really starting to put things together that's allowed you to prioritize your focus more as far as maybe that patient population you want to target. Obviously the tools are coming up um, with maybe the vision of where the program wants to go to allow you to do those things easier. But I think really just honing on the basics that were learned, if you will, by going through it so manual to now apply those tools and resources, to their maximized effort. And any areas that you would suggest? I know you mentioned, closing the gaps, right? Can you just kind of walk through that or kind of that overall premise of closing gaps and how that kind of benefits and change into, those RAP scores initially?
Yes, and so with those gaps in care, so especially with your Medicare Advantage, if you're able to get the reports even to show, okay, this is what was previously documented and coded for this patient. So right now we're in year 2021. And so if you're able to see either through your software or through the Medicare Advantage program, or even just doing a chart review, you can go through your claims and say, okay, these were all the diagnoses in 2020 that were documented and coded. So when you're doing those reviews for 2021, you want to make sure that you are picking up all of those diagnoses that were documented and coded in 2020 and pulled them forward to 2021. And if some of those were not valid or some of those have, you just are not appropriate for the patient, you want to address it and make sure it gets off the chart. So that's where they kind of call it closing those gaps, because you want to pull forward what's appropriate or things that are not appropriate to remove. And so that's where when that verbiage of that closing the gaps for those. And you're right, for the manual process, I'm actually kind of glad we did do that to learn, only because then when you get the software, you already know all the steps that you really had gone through manually that you want to be reflected within those software, and you kind of know what to look for. So even though it was a very tedious process, I am actually grateful for that to have that experience.
Absolutely, right. And I think that kind of goes along with kind of the second version of that, which is the provider buy-in, right? Being able to do that in a more manual progression, if you will, um, and allows that dialogue to really take shape at least initially, and then now being able to what I would anticipate lean on the software, but still kind of have that interaction to be able to really isolate down each encounter to a singular interaction to be able to really kind of get into the detail, right? Now kind of get lost in translation just because the software is there for you, but also being able to identify the reasons why maybe the extended discussions need to be had, or proactive query results in the clinic setting, let's say. Anything as it relates to maybe differences you may anticipate as far as that provider buy-in on the manual side, and then now looking to revitalize with bringing in that software component. Anything that you foresee that may still be the same old challenges, or anything that allows you potentially to ramp up that outpatient once that does get engaged, to where allowing the software and the providers to kind of have a harmonious relationship, but still being able to kind of peel back the layers and get down to the basics when needed.
Yeah, and with anything, just making sure to have, that education is always important. And then if you have, those physicians that, are champions or someone who can be there to advocate for it, because I think that again, that's just getting that provider buy-in as long as you have that support and advocation there. Because, as always, you have all those nudges or those things that, could be ignored, but if you have that education and the support to help them understand why this is important, and why we're needing to do this, and then having some of the providers that are able to advocate for the program, I think that would probably be the most important, just to get that buy-in and having that why and why it's important.
Yeah, absolutely. And again, I think that that goes along with building up, those communications, right? Because I'm sure you saw those challenges, from a manual perspective, delivery of clarifications, or just overall education delivery, which I would anticipate maybe a little bit more direct now from a software perspective, but still again relying on the basic reasons for wanting to engage providers and or review patients in a certain manner, to allow you maybe to still kind of get there on your own terms, right? And pull in the information you have to allow you to make a better assessment, when it comes to the engagement with that provider. And I think again that revitalization and kind of going through that process initially, there's definitely been a lot of programs that have been in that seat, and I think that now that software is kind of catching up to it, obviously budgetary, right, plays into it. Other sort of integration, I'm sure, challenges. So even just really being able to start somewhere, to kind of test the waters. Do you feel like again that allowed you maybe to really hone in on those workflows? I know we were kind of discussing this in the practice room, but just letting the software now kind of do some of the work for you to maybe identify where some of those workflows are going to go, rather than having a prejudgment on it now, right? Allowing the information to come back to you, and then allow you to make more educated decisions based off of any trends you're seeing. And again, do you see that from a software perspective, and just from an overall visualization standpoint, now having gone through it one time, let's call it, you know, what are those expectations now from a revitalization, sense of foundation, and kind of really getting that thing kicked off the ground, once that does become engaged? Are those expectations maybe a little bit shorter, since you've done it before, and now it's really just adding those enhancements? Have you gotten into, those windows of again opportunities to kind of really show the value, and now revitalizing that program with some other tools and enhancements?
And especially with the software, because of, before with it being such a manual process, we were only really able to see maybe 10 or 12 is like first. That productivity piece, I think, is really going to increase with the software, because then not a lot of the CDS's time is going to be spent trying to manually go through all of the documentation, like each encounter. So now with the software, that pulls up that patient, and it pulls up the encounters, and it pulls up, okay, these are what was already captured. This is the suspected. So I think that far as like productivity is actually going to increase with the software, but also, just having, that knowledge already of what to look for, like all that is, I think, one of the main pieces is the productivity. And then also, being able to easier identify the patients that are the highest, prioritizations with that. Because before, we pull a schedule and see who's coming for upcoming visits, but they may not necessarily be the ones that have a lot of those gaps to close, or they may not have that high of a risk score or a deficiency or anything like that. So I think even for like cost factor, having that software to be able to identify the patients who are the most priority to see, and also with productivity, which again will help with everything, as well, just pulling all that together.
Absolutely. And then anything as it relates to, from a transcription perspective, or I should say from a scribing perspective, any sort of conversations as far as dictation, or any of those other sort of additives to a software that you know I believe allow for some clarification. But sometimes they do confuse some things just by picking up on a word, and kind of taking you down a random path. But obviously, I think that's where CDI acuity and acumen still comes into play, and that critical thinking aspect, no matter what type of software you have. But any sort of enhancements that have kind of been discussed, kind of once you test market out or do revitalize that program, with that software component, that you see are other layers to add on? Or is that something you think kind of wait and see, and then let your for lack of a better term, your software vendor or provider allow you to kind of collaborate, no pun intended, on some of those enhancements that may then, help out with some of those trends. Is there anything that's kind of been in discussion as far as, okay, if we see this, we can now turn on these other enhancements in the software because we feel like we have the process down? Or do you think that kind of comes more along with, moving through this new charted territory with another tool at your disposal, if you will?
Yeah, I think that would be something, whatever the vendor that, with the organization, because I know there are different pathways, like Fluency, Direct, HCC Collaborate, they have different things to where you can have it turned on for just nudges for what is there, or maybe even, suspected that. And again, that's just going to really depend on your software vendor and having those conversations with them. I think that would be something that would have to be discussed with those vendors.
Yeah, no, for sure. But I think you touched on it, right? The biggest thing I think with being able to get that in play is really starting to monitor productivity, right? And really understand what that means, right? What's the caseload? What are some of those metrics that can now be defined because it's a little bit more uniform? And I think that was obviously a little tedious, right, from a manual perspective. So you couldn't really, I would imagine you couldn't really keep consistent, right? And I think that tool will allow for kind of more ironing out those SOPs and those workflows to kind of enhance that productivity and then be able to kind of benchmark that. I would imagine, right, that's definitely a big portion in being able to kind of maximize your team. And then obviously the revitalization, right, just kind of getting those components together.
Right. Yeah. Just looking at that, once it's there, once the, software is in place, like looking at, okay, these are, the things that are being pulled forward and, is there opportunities, for suspected diagnosis and the reports on that to show those areas. Okay. This is what the software did pick up on. Now, these are the opportunities that we could possibly increase. And so, like you were saying, that we can look at that in order to establish a further process to see what can be in place, things like that. Yes.
Okay, fantastic. Well, again, thank you so much for the presentation.